What is this dengue fever? The dengue fever is the commonest arboviral disease. It happens to be endemic. It's around 130 countries have this particular disease. Out of that, 70% is in Asia. So there are 4 serotypes mainly in dengue fever. There are serotype 1, 2, 3, 4. Okay. The main common cause of this particular disease, dengue fever, is through the species known as Aedes aegypti. The mosquitoes, Aedes aegypti, through the mosquitoes, mainly the Aedes aegypti and the Aedes albopictus. There are some other Aedes species also. The most common is among this Aedes aegypti. So there are 4 serotypes, and these 4 serotypes, it cannot protect against each serotype. There is no cross antibody protection. You can say the one serotype cannot protect the other serotype. So the incubation period of this particular disease is 3 to 14 days. 3 to 14 days is the incubation period. 5% are symptomatic, 5 to 10% of patients are symptomatic, whereas the 90 to 95% are subclinical. So the incubation period is 3 to 14 days. The symptoms which can come across is saddle fever, severe joint pain, severe back pain, which is called as breakbone fever. Breakbone fever is another name for dengue fever. So retroorbital pain, headaches, okay, severe myalgia. These are the common symptoms which come across again in dengue fever. Now, there are 2 types of cycles. The transmission is by 2 cycles, sylvatic cycle and urban cycle. Sylvatic cycle is also known as jungle, okay, jungle cycle. The transmission is between monkeys and the mosquitoes. Sylvatic cycle, the transmission is between monkeys and mosquitoes, whereas in urban cycle, the transmission is between humans and mosquitoes. So mosquitoes are the one which is the reason which causes dengue usually. Okay, it can be through monkeys, it can be coming through the human. In urban cycle, in monkeys, monkeys are reservoir in the sylvatic cycle. Now, how can it be diagnosed? There are certain tests you can diagnose. The first 7 days, there is no role of immunoglobulins in the first 7 days. You can do an RT-PCR, blood culture test can be done. RT-PCR means reverse transcriptase polymerase chain reaction test. The first 7 days blood culture and the RT-PCR test can be done. The IgM is sensitive from the 7th day. After 7th day, you can do the test of IgM, and even IgG persists throughout the life. It is about around 4 times it is increased in the IgG values 4 times, 4-fold increases happens in during the disease. It persists during the lifetime. So IgM is sensitive from the 7th day. The first one is RT-PCR, and specifically saying you can do a test of NS1, non-structural 1, strain 1 can be done, dengue NS1. Okay, that is the first 7 days. So from 7th day, IgM can be sensitive, a good test to do. Pathogenesis, what happens usually is that if we have exposed to one first strain, there is a self-protection. The protecting immunity is there in the beginning. Second time we are infected with another strain. What happens? It can lead to the release of vasoactive cytokines, which can result in the coagulopathy, or it can result in like hypoproteinemia, complications like pleural effusion. All those things can happen as a part of the severe form of dengue hemorrhagic fever. Okay, treatment is mostly symptomatic. Symptomatic treatment is the main thing. So you cannot give the painkillers so left and right, because it can affect the platelets. The platelet count is going down in dengue fever. Usually in every viral fever, the platelet count can go down. So you cannot give left and right painkillers. Symptomatic treatment for fever you can give paracetamol. So what symptoms are? And mainly hydration is a must thing. A must do. The do is like you have to hydrate yourself very much. So what are the risk factors of this thing? Okay, treatment was symptomatic mainly, but we have a vaccine now, dengue vaccine. Okay, it has to be the evidence of a previously infected dengue person only can have this particular vaccine. Okay, it is 10 to 16 years of age. 17D strain vaccine is given 0, 6 and 12 months from 10 to 16 years of age, but the evidence of a previously infected dengue has to be there. That's the treatment mode. So risk factors, coming to the risk factors. The risk factors can be, usually whites are affected more than the blacks. Females are affected more than males. Children less than 12 years are affected more than the adults. So the risk factors are more. So less than 12 years, whites, males, South Asian strain. These are some of the risk factors. Okay. Then variant, the first variant compared to the second variant is affected more. So these are some of the risk factors you can come across in dengue.